Welcome to our YouTube channel. Today I want to speak about stroke patients and ways how to understand this disease a little bit different and how to support stroke patients, and so that there is a possibility, a higher possibility that they can recover. My name is Rüdiger Fleisch. I'm coming from a medical background. I've worked as a medical doctor in the late 80s, and let me be your teacher of finding new ways to perceive and to think about these important topics. When someone suffers a stroke, it comes out of the blue, and mostly, of course, later you learn that there were kind of basic symptoms or situations in the body like high blood pressure or diabetes or other things which were already there, and then all of a sudden, this stroke just happens. This is for everyone a shock, especially for the patient, because the patient sometimes finds himself in a situation which is really, really challenging is not the right word, which is really kind of severe. In the worst case, the patient can no longer walk, can no longer speak, has difficulties with eyesight, or is even blind or paralyzed. However, the brain and the nervous system is an interesting thing, so to speak, because it has something what we call in neuroscience neuroplasticity. Neuroplasticity means that if you do something for a certain amount of time, let's say you practice piano and you do it for a certain amount of time, then your brain, this area in the brain gets more formed, so to speak. More synaptic connections are there, and you can see that also in the MRI. So what does this have to do with our stroke patient? First of all, I think it's very important that you understand the situation the patient is in. It's really severe. And of course, relatives usually also are in a deep shock. As understandable as this is, it's not really helpful to stay in there for the relatives. It's very good for the relatives to come a little bit out of this shock and to develop a kind of basic optimism. I do not want to say that all stroke patients can recover, but a lot of them can, and I have encountered people and patients in hospital who really were in a bad situation and they could recover. So what can we do, and why can we do something? The brain likes to be stimulated, and let's say after a while and after a moment, it's very good that we do not get stuck in all this deficit thinking. What's very, very important is that the patient, also supported or even stimulated, initiated by his relative and relatives, starts to develop a kind of curiosity. Let's see what's possible. And let's see how this can evolve to the better. Whatever you do can stimulate and stimulates your brain. The interesting thing is that whatever you don't do also stimulates your brain, in terms of it shapes the capacity of the brain. So one of the most important things is this term of neuroplasticity. There's something science has found, that the brain has astonishing and amazing capacities to recover so that other areas can take over other functions, to support it by doing. And recovering is possible. So, how can we support that? And how can we, as relatives or even as patients, what can we do? One of the very important things is that you try to teach your brain something. Teach your brain to deliver you a kind of neutrality towards the paralysis. I know what I'm talking about, and neutrality towards the paralysis. This is a momentary state. We do not know how long it will stay. We do not know when it will be removed. But teach your brain to deliver you some positive memories, positive pictures, things you feel really good with. This means also for the relatives not to approach a patient in a state of, oh, what's going on today, as understandable as it is. But really also to try to get into a good state, into a really good state. And I know it's so difficult if you see your beloved one in a bad state, and now I tell you to come to a good state. But we know that if relatives are in a bad state, patients are even in a worse state, because they try to comfort their relatives. And this is something which is costing a lot of energy. So we will not challenge or waste the energy of a patient by being ourselves as relatives or as therapists or as medical doctors in a bad state. So, one thing you could do it is to talk with a patient about, let's take 10 minutes and talk about good times. Let's imagine good times we have, without this grief, without this sorrow. Just imagine, was it nice when we were there and there? Do you remember this and this? And please agree upon the patient that you want to do it together with the patient. So this is really, really interesting. The other thing is, what's really important is also that, and you see that often and hear that often from self-help groups of stroke patients, people have a will. Yes, they have. Patients have a strong will. They're just sick. They do not have a weak will. It has nothing to do with that. And then they start, to have also a strong will, setting goals. In 1 month, I want to be up, want to be able to walk up the staircases. That's good. But if you push too hard, the brain doesn't like it. If you say in 1 week, in 1 month, I will. This might be too narrow, this might be too hard. What's much, much better and easier to do is start to stimulate your brain by playing with it. Imagine you could walk up. How would this feel when you walked up? See yourself walking up the staircase, for instance. It might take as long as it takes to get up there. But how would this be? What would you feel? This joy, imagine how you would, be happy if you go up there, because you really can do that. And this is so important, that you stimulate the capacity of your brain to be able to imagineer something. Imagineering is a technology. It comes from the verb to imagine something. Technology behind is to do it on purpose, not just by chance. The other thing is, for instance, I found out patients have, let's say a patient has a paralyzed arm. can stimulate a little bit the brain by encouraging the patient to act as if he or she could move the arm. Imagine you could draw a virtual arm out of your physical arm, and you could wave with this arm. You could move your arm, you could grab things. This sounds a little bit weird. Don't forget to put your virtual arm back in your physical arm. It sounds a bit weird, but it's not. We know from different therapies, Alexander technique, we know from hypnosis that people can levitate their arm, for instance, in trance and under hypnosis. And even if their arm is paralyzed. And it starts with the ability of the brain to imagine something. It's also good, third point, is also good to say, mostly when something like this happens, we are anxious about the deficits. You cannot move this, you cannot move that, you cannot do this, you cannot do that. So our focus gets grabbed into that, what's not possible. And if someone comes in, maybe patients go like, this person doesn't know what this is about. First of all, every one of us has the freedom to say, I do not want to listen to this person, of course. It's your decision to do that or not. The other thing is, it makes a huge difference if we try to doubt our doubts. Which means, I'm in a bad state as a patient, and I will never get out of it. Please doubt that. There is no truth which says, well, it's like this or like that. Even medical doctors have a hard time really to predict what will happen. Because of the neuroplasticity of the brain. The brain is an amazing organ. It can really recreate in an amazing way. So there is no need to give up this kind of maybe it is. Maybe it's easier to recover as you think. And the last thing I want to talk to you about, the fourth topic today, is you as a relative, you as a patient, if you talk to others through self-help group, sometimes it's very important to say, well, I really feel bad. It's okay. And it's also good when people are there and say, I understand you. I try to understand. I cannot imagine how it is, but I'm here with you. Sometimes we do not have to understand in order to be helpful. Sometimes it's much easier and more helpful to say, I'm here. I see you. I can see how you suffer. So it's this kind of acknowledgement. Because if you are outside of this disease, thank God, you have no idea how difficult it might be from time to time to be inside the body while the body has this disease. But you as a patient are not your disease. One thing you can do is really not to repeat the suffering and the horror over and over and over again. I was checking some self-help groups on Facebook the other weeks, and I found interesting patterns there which are not helpful to recover. I appreciate when people are, encouraging each other, that's wonderful. But if you check a little bit from other perspective, you see that, for instance, one day someone was telling, well, I'm dizzy in the morning. And instead of, no, someone would say, well, oh, you're dizzy, okay, are you afraid, okay, what can you do? This question, what can you do? What can you do to feel better? What can I do for you? Is there something you need support in? This would be something which would be helpful. What's absolutely not helpful is when other people go and say, Oh yeah, that's the same with my mother. She suffered a stroke last year and she also is dizzy now. What you do is just you create this heaviness. But what you need is lightness. Do not need this heaviness. And it's like a big pot. You're sitting in a big pot and others put in the heaviness as well. So what do we learn from that? Not everybody who is not talking about heaviness is arrogant or ignorant. Not everybody who is talking about the same difficult things and is complaining about that is your friend necessarily or supporting you. So stick with the thought of neuroplasticity. The words which get chosen, the way we think, what we stimulate to do also what we like. If you have a paralyzed left arm, try to do something with the right arm. If you have a paralyzed right arm, do something with the left arm. It might be an interesting experience. And I know what I'm talking about. So this is something I wanted to tell you. And if you have further questions, send us a feedback. You can subscribe to our channel for more videos. You can leave a comment there or a question and we come back to you. Thank you so much.